Assalamualaikum warahmatullahi wabarakatuh. In this video, we will discuss about the virus that caused Spanish flu and COVID-19, also the similarity and differences between these two viruses. Spanish flu is an influenza pandemic that arose around 1918 until 1919. Spanish flu is caused by influenza A virus H1N1 with gene from avian origin. This virus has infected about 500 million people all around the world. It affects the respiratory system of children and adults by destroying their lung tissue. In many cases, the victim's skin turning blue and their lungs filled with fluid, making them unable to breathe. This virus of H1N1 is closely related to classic swine virus. According to researchers, they have suggested that this virus is spread from human to swine. This has been approved by analysis of antibody of 1918 influenza survivor in late 1930s. Unfortunately, there are no vaccine or effective drug at that time to cure or prevent this virus from spreading to other people.
Coronavirus disease 2019 or COVID-19 is an infectious disease caused by a severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. The first known case was identified in Wuhan, China in December 2019. This disease has spread worldwide and leading to an ongoing pandemic. This virus is transmitted when people are exposed to a contaminated respiratory particle that infected people as they talk or sneeze. A person could get a COVID-19 indirectly by touching contaminated surface or object before they touch their mouth, nose or eyes. But with several precautions like wearing a mask at the crowded places, keep a distance from others, can help to reduce and prevent the virus from transmitted. So always take care and stay healthy.
Hello, my name is Nur Emilia Natasha binti Rahim from AS20118. So today I want to talk about similarities between Spanish flu and coronavirus, or we call as COVID-19. Both Spanish flu and COVID-19 can be transmitted from person to person through airborne respiratory secretions. According to WHO, Spanish flu spreads faster than COVID-19 since it has a shorter incubation period. Usually, Spanish flu symptoms begin in 1 to 4 days after exposure, while COVID symptoms begin in 1 to 14 days after exposure, typically around day 5. Both COVID-19 and Spanish flu can have varying degrees of signs and symptoms, ranging from no symptoms to severe symptoms. Common symptoms that COVID-19 and flu share includes fever or feeling feverish or chill, fatigue or we call as tiredness, cough, sore throat, shortness of breath or difficulty in breathing, runny or stuffy nose, muscle pain or body aches, headache, and the last one is some people may have vomiting and diarrhea, though this is more common in children than adults.
Hi, so the differences between the Spanish flu and COVID-19. First, the researchers believe that Spanish flu outbreaks are in 1918 and COVID-19 were in 2019. Next, the causes of this pandemic of Spanish flu comes from the H1N1 virus, while the COVID-19 come from the SARS-CoV-2 virus. And the researchers also believe that the virus caused of Spanish flu is by birds, and the COVID-19 is from the descendants of bat coronavirus. Next, the origin of Spanish flu first identified in the military personnel United States in the spring of 1918. Reports suggest that more United States soldiers died from the 1918 flu rather than in World War I battles, while COVID-19 were first human cases reported were in Wuhan City, China in December 2019. Reports suggest a wholesale food market in Wuhan was the source of the outbreak. So, the number of people killed in Spanish flu were 50 million worldwide, while COVID-19 last update in 19th of March were 3 million. The number of people affected in Spanish flu were about 500 million, while in COVID-19 last update in 19th of March also was 1.65 million.